Hello, how are you? This is Karina, your medical massage therapist with over a decade of experience. I've been working with a lot of surgeons in the area of Central Florida, and I have so much to share with you guys. So finally, I have time to record these videos to just to share with you a lot of information that I have actually here in my hands. So we're gonna start by telling you, okay, everything that I'm telling you is my own experience with patients. I've been seeing so many patients since 2019 that I decided to go fully just doing lymphatic drainage and post surgery massages. I've been in medical massage since 2010. And then I was just doing regular massages, therapeutic massages, spore massages, stretching, deep tissue, pregnancy massages. So it was the whole massages modalities that you can imagine, but actually it wasn't until 2019 that I just decided to change my menu for lymphatic drainage and post-surgery massages, and then after that I didn't have time to do regular massages anymore. So here you go. The first the first things that I want to talk about is because I have clients that they said to me, Karina, I when I go in and look into to see what kind of doctor, because I asked them, I said, how do you found this surgeon? How do you like him? Because I always ask questions. I love to when you ask question and you listen, that's when you're gonna learn so much about your patients. So that's one of the things that I always ask questions about. Okay, so are you happy with your result? Who is your surgeon? How did you found him or her, and so on. So some of them they say I don't even knew how to look for, what to look for. I didn't know. I was scrolling on Instagrams and I started seeing the before and after of this doctor surgeon in South Florida or in Orlando or in other places. And I said, okay, so what made you decide to go with this surgeon? And they start telling me their, experience. But this is one of the things. I have the 10 most important questions that you need to ask your plastic surgeon before you decide to do anything. And this is obviously some of those information you can definitely find it online because they expose online if they are, for example, certified certified plastic surgeon, board certified plastic surgeon. So you will know if they are and why you want a board certified plastic surgeon. It's because then you know for sure that that person, that professional, that surgeon complete all the curriculum and have all the certification that they need in order to perform the plastic surgeon. You want to put your hands on someone that knows what they're doing. Another question that you need to ask, for example, is how long have you been doing this type of procedure? You want to know if that person actually is experienced in that. Let's say that you want to have a mommy makeover. A mommy makeover is a tummy tuck or menoplastia plus the breast implant reduction or lift. It's whatever you decide. And also some liposuction on the flanks, on the waist. So that is a mommy makeover. Usually, women that have a lot of skin after having kids, for some reason, our body accumulate a lot of skin in that area. For the skin get very stretchy, and I find out that later after my pregnancy, if you don't use the compression garment or faja, that's what happened. We ended up with a lot of skin in that area, in the abdomen, lower abdomen area. So anyway, another question that you want to ask your doctor is how many years of experience you have performing this specific procedure? Oh, that we went through that already. Can I see before and after photos of your previous patients? You can find those information online, like I said. So most people go and they, scroll down and find out about that. What are the potential risk and complication associated with this procedure. You need to know if there's any complications. You want to ask your doctor, your surgeon, what about if that happened to me? Or and there is a lot of things that I don't agree. A lot of people go online on Facebook groups and they start seeing horrible things that happen to another person. You need to understand everybody heals in a different way. So that means you do not have to be that person. It doesn't have to happen to you, you know? So it's like, don't be afraid. Oh my God, this is going to happen to me. First of all, please don't go to those group and start looking at all the horrendous things that can happen to other people. It's not going to happen to you. Or look at it, but don't think it is going to. Do not become negative, because believe it or not, people that are negative have very hard time recuperating after plastic surgery. I've been seeing with so many patients. So this is one of the things that I would tell them. Keep positive. Everything's gonna be okay. Everything's gonna be all right. You have to follow the doctor's instruction, and nothing wrong can go from it. There's a lot of other things that we're going to be talking in other videos regarding hydration, taking the medication on time, eating protein, eating well, healthy, not moving. When you have I have a lot of patients that they are very active people, and sometimes they don't take the correct time or the specific time, I should say, the doctor, the surgeon asks them to rest because they're used to do so many things. They are not used to depend on anyone. But let me tell you something, I ain't seen at all. If you take the time to relax and to let your body heal. That's what I wanted to say. Let your body heal so that you will recuperate without any complications. I don't know how important and how many times I have to repeat a lot of patients. Please don't do it. Don't do it. If you have an arm lift, think about it. We use our arm for everything. But if you're a person that is super active, if you want, after 1 week and a half of your surgery, you want to start cleaning, mopping, and sweeping your floor of your entire house, what do you think? How do you think your body's going to react? It's not going to go well. Probably a little tiny bit of your incision is going to open. And then from there, a lot of things can happen. So just rest. Please plan ahead. But we're going to talk more about that later on. Okay? Okay, so I have more questions here. We went through 1, 2, 3, 4. Here we go. It said, what will the recovery process look like and how long it will take? I'm going to tell you something right now. One of the things that I hear often is like, the first things actually that I ask my clients is like, okay, this is your surgery. So are you working? And most of them, they say yes. For how long did you take off from work? Because sometimes people think 2 or 3 weeks is enough for a mommy makeover. I'm telling you right now, no, it's not. You need at least 5 to 6 weeks. Not kidding. Unless you're a strong person and you can manage pain and discomfort very well. And then yes, if your doctor said in 3 weeks you can go back to work, and then you can go back to work if you feel okay. But in order for you to recuperate well and have your body have that rest that needed, and for you to be 100% okay, if you have the time, please take between 5 to 6 weeks. It's going to make a huge difference in your recovery. I can tell you stories about that. Another question is, where will the surgery be performed, and is the facility accredited? Because you want to know if the facility where you're going to have your surgery actually is a legit facility. You need to ask those questions. on the description below, I'm going to put all those questions so you have it handy. And then you keep in mind before you choose a plastic surgeon to put your life into their hands, believe it or not. Number 7, what type of anesthesia will be used and who will administer it? So obviously the anesthesiologist is going to be administered, okay? But is there qualified to do that job? Are there actually certified anesthesiologists? All those questions you just ask. You want to make sure that everything's going to be okay. Number 8, what is the total cost of the procedure and what does it include? Make sure to ask if your surgery, the total of your surgery. What happened if last minute the doctor finds something that you need to get it done in order to accomplish the total beauty that you're actually looking for? Ask them, are that's going to be extra charge or it's going to include with the first price that you're going to give it to me? I know some people, they take money out of the 401k in order to get those plastic surgery. So it's important for you to have all the money. Another thing that is important for you to have the money is to the post care, after care. You're going to be spending a little bit more money, not just on your surgery. You're going to be spending money and probably some medications, or you're going to be spending some money definitely in lymphatic drainage massages. You're going to be spending money also in garments, compression garments or fajas, however you want to call it. You're going to be spending that money. And so a lot of people say, I didn't know. I thought that I just needed to have the money for the surgery, and I didn't know that I need massages. Well, that is another topic that we're gonna talk about it in another video. And then number 9, how do you handle revisions or complication if the outcome does not meet my expectation? That's what I'm talking about. If for some reason you're not satisfied with the final result, let's say that 6 months pass by and definitely something was not completely okay with what you were expecting. So what happened? Yes, they're gonna come back with you probably most doctors. Don't get me wrong. You need to ask and you need to make sure to read the contract that you sign with the doctor surgeon. But most surgeons, they said, okay, we will cover if something doesn't go right. We'll cover the revision. But you have to pay for the anesthesia or the extra medication or anything. There's always an extra cost if something doesn't go well that you have to keep in mind. Okay. And then the last question. Let me see. Yeah, the last question is, do you have hospital privileges? And if so, in which hospital? Most doctors I know that they operate or they perform the plastic surgery in their own clinics, okay? Or in some clinics nearby their office. It depends on what kind of surgery you're having. So make sure to ask those questions, and so everything's going to be okay. That is before those questions that you want to keep in mind is to choose the right plastic surgeon, okay? So do your research, go online. Don't think if you go online and you prepare yourself with enough time, not just 6 months, prepare yourself maybe 2 years, 1 year in advance to have a wonderful result. And we're going to talk a little bit more about that in another videos, okay? And this is a bonus tip. Trust your instinct, okay? A good surgeon will listen to you concerns, provides clear and detailed answer and make you feel confident and care for throughout the consultation. Take your time to research and never feel pressure to make any decision on the spot. And that is so sure. If you go to consultation with any plastic surgeon and you feel like you were not being listened, in your instinct are telling you, I don't think I should go there. But all my friends went to this doctor and he's amazing. Just listen to your intuition. I have patients that they went to South Florida and they never met with the surgeon except few minutes, not kidding, few minutes before the plastic surgery. I wouldn't done that. No way. I cannot put myself, my life and someone that I never met. I need to feel their vibe. I need to feel their energy. I need to know that they're going to do a good job. I'm a very observant person. So guess what? I'm going to want to go to the office. I want to look at people that are going to be in charge of my life for those 6, 7 hours. It depends on the surgery that you're going to have. And then make the final decisions, and then ask those questions. I'm going to post all those questions on the description. So I will ask you please to subscribe, like, and I will see you in the next video, okay? Much love. Bye. Thank you so much.